for this first meeting of the Global Consortium of Climate Change and Health Education and Global Network for Academic Public Health on climate change and health education for faculty members. I'm struggling to share my screen at the moment. I'm not sure if I need to, but I should just say by way of introduction that many of you will be familiar with the Global Consortium of Climate Change and Health Education, and we'll be hearing from the director, Cecilia Sorensen, in just a few minutes. I should say for the Global Network for Academic Public Health, we are representing something like 500 schools of public health around the world in those regions of the World Health Organization. We have the US, we have Europe, we have Africa, Australasia, two Asian organizations, and ALASAG from Latin America. And we are very much concerned with developing public health workforce, and we're very active with the World Health Organization on that front. But we're also very keen and enthused by the agenda of climate change and health and the needs for training in this area for all of our schools across the world. Climate change has been described as the greatest threat to health in the 21st century, and we very much see it as a priority for the global network that we address climate change and health education, and in this particular course that we help you to develop your skills and resources and knowledge to be able to teach your students and to advocate and educate with the people around you, be it in your universities or be it in your national governments. Anywhere that we need to get over the message about the imminent threat of climate change, then we need to very much gear ourselves up for that issue. As moderator today, I just need to let you know that closed captioning is available in the CC button on the dashboard for Zoom. So that you will also be able to see the proceedings in Spanish, so that is for our colleagues needing to speak in Spanish. Daniele, sorry, advise me. Do you want to go to the introduction from Cecilia at this point?
Sure.
Okay. Can I leave my screen or do I have to empty it again?
No, I will.
Hello, everyone. Good morning, good afternoon, and good evening. On behalf of the Global Consortium on Climate and Health Education, I'm delighted to welcome you to the Climate Ready Classrooms course. It's inspiring to see so many dedicated faculty members with us today, online and asynchronously, committed to preparing the next generation of health professionals. As educators, you are not only teaching concepts, you are shaping future leaders and shaping the future of public health. Our shared goal is to equip students with the skills to move from knowledge to action, from understanding climate science to leading interventions that truly protect communities. The curriculum which we will explore in the coming weeks is grounded in the GCCHE core competencies for health professionals and informed by our global surveys of public health schools. These surveys reveal something important. While many programs already introduce climate and health, critical gaps remain in applied skills, preparedness, and leadership. Climate Ready Classrooms was created to help close these gaps, and we're delighted to work with many partners, including the Global Network for Academic Public Health and all its associated regional associations, in order to make this course possible. Through lectures, case studies, and shared learning, this course will support you in teaching students across the full spectrum of competencies, from identification and prevention to preparedness, response, and leadership. We want our students to graduate ready to analyze risks, design solutions, engage communities, and influence policy. Ultimately, the impact of this work is clear: to ensure that climate change is not treated as an optional topic, but is fully incorporated into mandatory curriculum of every public health program worldwide. Thank you for your commitment to this mission. By incorporating climate into your classrooms, you ensure that students not only understand the challenges, but are also prepared to lead with solutions. Welcome once again. I look forward to the impact we will make together and hope your institution will consider joining the Global Consortium on Climate and Health Education, where over 420 schools from 70 countries are already working together to address climate and health education gaps. I look forward to this journey together.
Over to you, John.
My screen sharing's not returning.
Yeah, you should share again.
So,
Yeah, perfect.
so over the next 12 sessions, um, we will be, this is the schedule that we will be taking you through. Teaching climate change today, challenges, solutions, societal and science drivers of climate change, teaching heat and health, adaptation and strengthening, climate change, air quality, climate change, vector-borne disease, extreme weather disasters, droughts and food and water security, building resilient health systems, addressing health system vulnerabilities, strengthening health systems and ensuring health and service delivery, and climate mitigation, sustainability within the health system, and health co-benefits, and finally, communication, collaboration, and health promotion. So the objectives are to equip public health faculty with a deep understanding of science of climate change, its drivers, its direct and indirect impacts, enabling you to confidently integrate climate health concepts into your public health curricula. And secondly, it's to prepare educators to guide students beyond theoretical knowledge and applying the skills in risk assessment, in health systems resilience, community engagement, and evidence-based interventions. We also expect that through this series of webinars, you'll be able to explain key challenges and opportunities in integrating climate change into public health education, that you'll be able to apply Bloom's taxonomy to design an action-oriented curriculum that equips students with the skills to address climate-related health challenges. We also anticipate you will be able to evaluate different curriculum models for teaching climate change, including elective courses and full integration. And we also hope that through this work, you will identify strategies for fostering partnerships with local health centres, government agencies, and provide experiential learning opportunities. The logistics are that these are 90-minute sessions, including expert lectures and case studies. That the sessions will culminate with a question and answer section, and you should enter your questions for presenters. We said we got a QR code, I think, for that, but enter them in the question and answer. And not the chat, because the chat has already been filling up with your greetings to us all. Sessions will be video recorded. There will be slide decks and resources made available on the course website. And you must enroll in the course Canvas page via Columbia Plus in order to have access to these materials. And to enroll, use the link in the chat, please. Attendance is being tracked synchronously or asynchronously, automatically recorded synchronously when you join the live Zoom sessions via your personal Zoom link. Attendance will not be counted if you use a colleague's link, and watching on YouTube doesn't count as attendance. Asynchronous attendance means that you can watch the session recordings on the Columbia Plus Canvas platform, where your viewing will be logged and counted towards your attendance record. And note to use the same email address as your registration. Participants who attend 8 of the 11 sessions and pass the final exam at the end of the course will be awarded a certificate of participation in climate change and health from GCCHE. And you can also join our WhatsApp group, connecting via this QR code, which I shall leave up for a moment or two. As long as it takes me to do it, I'm very slow. And next we go on to the real meat of the session, which is our 4 presenters. I'm sure they will all introduce themselves to you. But first off, we have Daniele Magalhães, and then she will take us through the main presentation. And then we have 2 case studies from Rebecca Fournier from the Association of Schools of Public Health in Schools and Programs of Public Health, the US. And then we have Laurent Chambeau and Eric Toomey, leaders of the ASFA European Schools Initiative on Climate Change. So I think that's the end of me. And now I'd like to hand over to Daniele. Over to you.
Thank you, John. I'm going to share my presentation here. Okay. Can you see my presentation?
Yes, we can.
Okay. What about now?
Yeah.
Yeah, okay. So thank you so much, John, and welcome everyone. I'm very impressed by the number of people that we have here. And I think the reason of that is the emergency that we are facing every day. And I think this first slide pretty much express all the crowded impact of climate change on health. Climate change is transforming our environment, making extreme weather events more intense, more frequent, and these changes are already affecting people's health, both directly and indirectly. The impacts range from mild symptoms, spread of infectious diseases, worsening of chronic conditions, and sometimes even death. By 2030, the World Health Organization projects that climate change will cause around 250,000 additional deaths each year. So these changes output enormous pressures on our health systems. Extreme weather disrupt power supply, damages health facilities, contaminate waters, interrupt supply chain, limiting access to medicine, medical device, and essential care. It also damaged transport infrastructure and reducing the access for patient and staff to health center, while rising demand during and after climate events overwhelms emergency and intensify care units. So these realities underscore the urgent need for public health capable to identify, respond, and prevent climate change impacts. So over the next 10 sessions, we are going to explore all of these specific impacts that you are seeing in this picture. But today we are going to discuss about how to build a curriculum. So public health experts occupy a distinctive position in addressing the climate crisis because you are responsible to protect population health by anticipate climate-related risks, by monitoring disease and exposure, by preventing health impacts through surveillance and early warning actions. It also a role of a public health expert or professional to build resilience in the health system by assessing vulnerabilities and risks, also strengthening governance and preparedness, ensuring continuity of essential service, and implementing community-based intervention. You are also very powerful in advocacy and leadership, translating science into policy, engaging communities and decision makers, and fostering multi-sectoral collaboration for solutions. But we know that there are many gaps in the education of climate change for public health professionals, and that's what we are discussing here, and we are trying to address this gap. In 2024, the GCCHE did a survey among public health schools all around the world. We received more than 300 responses, and we saw that the education in low and middle income countries was more limited than comparing to higher level income countries. And at the same time, a separate survey also found that among 90 schools of public health in the US, 44 of them was providing climate and health education. So climate change education needs to be part of the mandatory curriculum, and we need to make this change as soon as possible because the emergency is already here. It's not something that's going to happen in the future. And when your students go into the market and we will have a lot of changes, the situation probably will be worse than we have today. So we need immediately to incorporate climate change on the mandatory curriculum of public health. So in this survey that we did, we also asked the faculties and the school coordinator to provide to us an information regarding the proficiency of the education that they are offering. So they were asked to give some range of proficiency from 1 to 3. It means that the foundation stage, like knowledge and understanding, was provided as a main education. From 4 to 7 was the intermediate stage that is related to application and analysis, and from 8 to 10 related to leadership and decision making. And we can see in these slides, we asked them to classify all these 8 domains. I'm not going to read. I think you can have that and you can evaluate, and you can also access this publication. This is an indicator inside the Lancet Countdown. This is an indicator of adaptation. But we also publish the full results in the Lancet Planetary Health, and you can have all this information there. So we asked them to classify all these 8 domains related to public health competencies. And as you can see in this figure in the right side, is that most of the schools, they are probably providing the intermediate level of education, and we need to advance. We need to provide leadership skills so they can be able to act and make decisions and be more in power of the plans and the actions on climate change and health. And so that's what we are going to try here with this course, to bring you all the aspects of the real life so you can have access to solutions and to plans that can be taught to your students and incorporate into your curriculum. So here I select many drivers to start, and these drivers was we learned with our members. Like Cecilia told you, we have more than 400 universities, and we convened some meeting with them to understand how did they start to incorporate climate change in their curriculum. And I select some of the drivers that can also drive you, or you can also use one of these drive to initiate and to convince people in your institution. So the first one we already spoke about is about the global health emergency and the ethical imperative. So we know that climate change is an emergency, so we need to provide education and prepare the future professionals to this challenge. The second one is students' demand and engagement. So sometimes students can put petitions, surveys, and also create associations calling for climate and health education, and also asking the university to enhance their employability and their career readiness. The third one is related to local climate-related impacts. Many of our members start to incorporate climate change in their curriculum when their community or the location where the university was suffering with some climate impacts. It can be air pollution, heat waves, droughts. So they start to incorporate this knowledge and try to make the students understand the connections with climate change. So this is one way that you can start. Another thing is professional and accreditation standard. You can go to the national associations and accreditation to the public health and make changes and incorporate this core competencies as part of the competencies of public health professionals. You can also advocate that it's good for your institutions because they can be leaders in climate and health and attract more students and fundings and partnership, and it will also increase the research opportunities and fundings. And it can also be because of policies and governance alignment, you can provide more inputs to your local government, like developing national adaptation plans and all the other climate and health strategies. So those are some drivers, and you can use one, two, or others that you may have, but it's just to give an idea on how to start. And once you have your driver and you want to start, now is the time to evaluate how you are going to incorporate this core concept in your curriculum. So a well-planned curriculum directs teachers and students toward achieving specific learning goals, enhancing overall education quality. So the Bloom's taxonomy is a hierarchical classification that you can use to provide your students a range of and levels of education and levels of competencies that they need to acquire during their education. And you can start with the very low level of remember and understanding, and you can go through more actionable learning, like be able to apply, be able to analyze, be able to evaluate and create. And the Bloom taxonomy gives you many different verbs that you can use to express your learning objectives. So your learning objectives and your goals are the foundation of your curriculum development. They outline what students are expected to achieve by the end of the course or program. And these objects guide the entire educational process, ensuring that teaching and learning focus on clear and measurable outcomes. This is very important, measurable outcomes. We need at the end to measure what they achieved with this education. So, but great, Daniele, but I have no idea of the learning objectives and the concept that I will incorporate in my curriculum. So to facilitate this, the Global Consortium on Climate and Health Education developed this core concept, and this core concept is updated every 2 years and is reviewed by a group of more than 20 international experts. So we have this new version, super updated, and in this version you will find 5 domains. The first domain is knowledge and analytic skills. The second, communication and collaboration, policy, advocacy and professional practice, public health and practice, and clinical practice. So I think for public health, you can use 1, 2, 3, and 4, and you are going to find not only the core concept, but you will also find the learning objectives to achieve and related to that core concept. So this material is already in the material resource that we are going to share with you. And you can have access to that, and you can use this framework to build your curriculum. And you can plan the implementation. And when we talk about content selection, you are going to take a look in this core concept, and you are going to select and adapt this concept to your curriculum. First, you will need to select learning objectives that are truly relevant, while always maintaining awareness of the interdisciplinary connections between climate change, health, and related fields. Second, it's important to adjust both the complexity of the depth of the content according to the learner's level, the time available for your instruction, and the knowledge base that participants already bring with them. And the third one is in order to make your curriculum engaging and connect with the real life and empower future leaders, you should present examples, case studies that reflect the local realities or the global realities and both the climate challenges being facing and specific health systems contexts in which the public health professionals will work. This will ensure that the content feels concrete, practical, and applicable to participants' daily lives and practice. Another important dimension is the integration with the existing resource. Whenever possible, you should cross-reference this framework with professional standards and existing educational materials. This helps you to identify synergies, avoid unnecessary duplication, and build on the approach that are already well established. You can align this core concept with standard public health competencies rather than create an entirely separate curriculum. So the idea is to integrate climate and health content into existing course and training programs whenever it's feasible and possible. Equally important is the fostering interdisciplinary collaboration. Climate and health challenges cannot be addressed in silos, so we need to connect concepts and learning objectives across different disciplines and professions. Our goal is to design learning experience that prepares students to work effectively and in interdisciplinary teams, equipped to respond to the complex reality of climate and health. So this also means create opportunities for interprofessional learning and joint problem solving, where participants from different backgrounds can bring their expertise together and develop more holistic solutions. So I also would like to share with you other tools that we have from GCCHE in our website, and I would like to invite you to take some time in our website and explore all our tools and previous course that can inspire you, and we have also many materials that can be shared. Here we have this webinar among our members. It calls Member Learning Collaborative. And in this webinar, the members who already started climate change in their curriculum share how was their experience and what they learned and what they did, for example, to convince their colleagues, to convince the institution, or how did they start. So this is a webinar that we do every 2 months, and we generally invite different professions to participate. The next one will be in September 24. Will be related to nursing schools, and I can share with you the link if you are interested. I know that's not public health, but at the end, the challenges are pretty much the same on how to incorporate climate change in the curriculum. Another tools that we have is the resource bank. If we go to our page, you will find different professions and public health. When you click on this, you have several different tools and materials that you can have related to public health that can help on your to build your curriculum, to get more informed, and also to build to help on your lecture. We also have climate resources for health educators. Is a website that we provide a lot of lecture. So if you don't have time to finish your lecture and to prepare your lecture, you can go in this resource and you can find some lectures or some slides that can be used in your lecture. And you can also contribute to this website. You can send your lecture so others can have it as an example and can use it. And the lectures that we received, they are peer reviewed, and then we include them in the website. So you can use all of them, whatever you want in your class, and because they were already reviewed by experts in the field. And the last things that you have to do in your course is related to assessment and evaluation. You need to develop appropriate assessment methods that measure both knowledge and practical application. So try to establish mechanism or ongoing evaluation and improvement of climate health education program. Climate change is it's a very new field, and every year or maybe every month we have new information. So we need to have mechanisms to improve the teaching and improve the knowledge, and make sure that your students will follow these updates as well. And track learning outcomes and program effectiveness to inform continuous improvement and efforts. And here are some barriers that also our members share with us, and I would like to share with you and also bring some solutions. Of course, that maybe you can have a different barriers or you can find a different solutions. So, but this is something that people already face it, and I would like to share with you. So sometimes the barrier is related to lack of skills among faculties, and this is how we are developing this course here. What you can do is, for example, invite external professor and foster in the disciplinary collaboration. You can invite a professor in the science, environmental science program to give a lecture in your course if you are not familiar with some topics. And you can promote training and professional development opportunities if you are a coordinator in a course. You can develop training programs with professionals associations. You can encourage faculty exchange and joint courses. Another barrier can be the lack of interest or motivation among colleagues. This can happen. You can offer a short seminar showing the health impacts of climate change, and this can encourage them to also incorporate climate change in their courses. Mobilize students to request climate education. You can highlight links to accreditation standards and employability. You can showcase existing faculties already teaching related topics. Another barrier can be lack of space in the curriculum. So you can integrate climate change in existing courses, or you can create elective courses if it's possible. This is not the gold standard. We need to incorporate climate change in the mandatory curriculum, but if it's not possible, maybe an elective course can be the solution, or summer courses or workshop or short intensive courses. You can have also financing and resources constraints. So to salute that, you can partner with local health centers or administrations, and you can offer them your students' expertise in exchange to live a real life experience and solve their problems and you can have this financial benefit from these health centers. You can seek funding from NGOs, government, or international agencies. Climate change now, it's a very important topic, and there is a lot of available opportunities for fundings. Use open access or shared teaching resources like the ones that I share with you. Leverage students' project or small grants to pilot modules so you can partner with some institutions and provide like a consultancy together with your students. You can also have problems related to institution inertia or governance challenges. So you can secure endorsement from teams by aligning with the strategic plans and policies of the institutions. You can build a cross-department coalition. You can ask the medicine, the nursing, the environmental science, and you together ask for the incorporation of climate change in all the health professionals' curriculum. And you can demonstrate alignment with national climate and health priorities, so your curriculum can be relevant and your institution can accommodate these new changes in the main curriculum. So here is some references that I mentioned during this presentation, and thank you so much for your attention.
Thank you, Daniele, and thank you for taking us through all those core resources that we have with your organization and for giving us that analysis of the current state of climate change education around the world. There have been a number of questions in the chat, which questions in the Q&A, which have been largely answered via an immediate reply from Maggie O'Connell. But do keep the questions coming, and there are some that we can address later on. But without any further ado, let's have one of the case studies from Rebecca Fournier, who's going to tell us about planning and preparation for climate change curriculum. And so, Rebecca.
Yes, thank you so much, John, and hello to everyone. I'm going to be sharing a brief case study that has to do with a toolkit that ASPPH developed with GCCHE, and it digs down a little bit into part of what Daniele was explaining about implementing and integrating the core GCCHE concepts for health professions. So let me go ahead and share my screen here, and please let me know if there are any issues with the audio as we get started. And I will hide myself now, but I will come back for Q&A. Thank you. Well, hello, everyone. My name is Rebecca Fournier. I am Manager of Global Engagement at the Association of Schools and Programs of Public Health, or ASPPH, which serves as Secretariat for GNF. I had the privilege of joining ASPPH in 2021 as their Climate Change and Health Fellow, and I continue to be engaged in our work around this issue. Today, I'll be presenting to you a toolkit that we developed with GCCHE around integrating climate change and health content and skills into public health education. So for context, ASPPH was founded in 1941 and serves as a leading voice for academic public health. It is a 501c3, that is a nonprofit membership organization representing schools and programs of public health accredited by the Council on Education for Public Health, CEF, as well as those in applicant status for CEF accreditation, and has a mission to strengthen the capacity of members by advancing leadership, excellence, and collaboration for academic public health. Recognizing the urgency of the climate change and health crisis, ASPPH has prioritized a specific initiative around this since 2021, aligned with Goal 1 of its strategic plan, which is to advance solutions to the critical public health challenges facing society. An image of our website can be seen here to the right. In Phase 1, ASPPH established the Task Force on Climate Change and Health. The initial charge of the task force was to develop means for collective action to reduce the impacts of climate change on population health, and in 2022, it released a framework laying out principles and recommendations for both ASPPH as well as for schools and programs of public health to act through education and training, research, practice, and policy and advocacy, while approaching the issue through the lens of social justice, taking advantage of interdisciplinary collaborations and partnerships at all levels of society. In response to the framework's recommendations, Phase 2 of the task force identified a set of competencies deemed critical for a climate and health concentration at the MPH level, which were circulated and also put on our website. The third main component of our work over the past few years has focused on the toolkit. As most of us on this call today know, public health professionals truly are on the front lines of the climate and health crisis. But most lack the necessary formal training, and schools of public health have been slow to integrate this content into curricula, whether due to budgetary and staff constraints or competing priorities. So to address this gap, ASPPH and GCCHE collaborated to develop a toolkit, finalized in March 2022, that helps guide programs on how to embed climate and health into education. The primary target audience of the toolkit is faculty and staff in CEEF-accredited schools and programs who are involved in public health teaching and practice and/or planning curricula for Master of Public Health or MPH students. But it may also be useful for faculty at any institution, whether seeking accreditation or not, that offers master's level public health programs, as well as any faculty who create core content, design courses, or are interested in establishing climate and health concentrations at the master's level, yes, but also for the undergraduate and doctoral level. The toolkit offers guidance on integrating climate and health competencies into standing curricula, a framework for building an MPH concentration, and supporting materials for designing a climate and health course, including resources and a simple sample syllabus. So we'll go through these components briefly one by one. But before I dive into the components of the toolkit, I wanted just to provide a quick comparison between the GCCHE and CEEF competencies, as they're frequently used as a point of reference. Since 2018, GCCHE has convened an expert panel to develop health professional core competencies on foundational climate and health knowledge, abilities, and attitudes. Their framework is organized as 61 learning objectives in 5 domains and provides associated learning concepts. For the purposes of the toolkit, we focus in on those that are directly related to public health, so we'll be looking at 21 learning objectives. These competencies are climate and health specific and are intended as a guide for developing climate and health education in various health profession schools. In comparison, CEEF is a US-based accreditation agency that accredits schools and programs in public health, mostly in the US, but a select number internationally. And CEEF provides competency requirements around the specific skills and knowledge that students must demonstrate upon completion of an accredited program. These 22 core competencies are informed by the 8 foundational domains of public health, that is, epidemiology, biostatistics, systems, leadership, policy, communication, cultural competence, and systems thinking. In other words, they are not specifically focused on climate and health, and all MPH students must demonstrate their attainment. The first main component of the toolkit centers around identifying how to integrate the GCCHE competencies on climate and health into those foundational competencies required by CEEF of all MPH programs. Doing so can help demonstrate how the subject matter aligns with current curricula and help determine how best to address any critical knowledge gaps. With this objective in mind, we conducted a crosswalk comparing these 2 competency sets, indicating where they align and describing the nature of their similarity. So here you can see an example of how the crosswalk is set up. While not every competency from one set has a direct counterpart in the other, and while the verb taxonomy may be at different levels, there is significant overlap between the focus and skills required, and the provided resources can still be applied. You can see here that at least one reading, lecture, and course has been linked, but additional resources are provided in the appendix. This crosswalk is meant to demonstrate how the required CEEF MPH competencies can be met through strategic integration of climate change and health content and skills. In other words, this approach is not proposing the addition of new competencies, but rather that the commonalities can be leveraged to instill climate and health into existing curricula. The second major piece of the toolkit demonstrates how to build a climate and health concentration at the MPH level. A concentration is generally designed to prepare students to make strong contributions to a field through research, policy, education, advocacy, and practice. A climate and health concentration would allow students to develop an in-depth, masterful understanding of climate change, its effects on public health, and ways to mitigate its impacts. To develop this part of the toolkit, we work to identify best practices and requirements for the concentration by referencing existing CEEF-accredited MPH programs that offered a climate and health concentration, and pinpoint similarities and differences in their structure and content. The educational objectives of select institutions were compared alongside the GCCHE core competencies to identify 6 major overarching conceptual blocks. That is climate science, climate and health impacts, climate and health policy, mitigation and adaptation, global and regional risks, and communication and collaboration. Required and elective courses that were identified from institutional curricula were then categorized into these conceptual blocks. In some cases, the required courses themselves may not be sufficient to cover the breadth of a particular block. In these cases, schools and programs will often call upon cross-disciplinary or interdepartmental offerings for elective courses, such as through departments of engineering, physics, global health, or health policy to effectively meet the concentration objectives. Here you can see an abridged version of the table in our toolkit, which lays out the identified concentration building blocks and their associated competencies, with examples of required and elective courses. So, for example, any climate and health concentration should effectively address climate and health impacts, Block 2. Upon completion of the concentration program, as part of this domain, students should be able to explain the connection between climate and public health, Competency 1 within this block. They might be required to obtain this competence through a course such as Climate Change and Public Health, and/or be further expected to select courses like Principles of Toxicology, Environmental Epidemiology, or Food Systems and Public Health to fully demonstrate they have met the concentration objectives. The toolkit also provides an example course schedule across a standard 2-year MPH concentration, as seen here, based on a structure of 1 seminar-style course, 2 advanced climate and health courses, and 2 elective courses. This structure was based on the observation that, among the programs examined, MPH students are generally awarded a concentration in addition to their departmental degree if they complete between 5 and 8 concentration-specific courses. Some institutions might elect to have students also complete a climate and health-related integrated learning experience or thesis as a concentration requirement, either in a general way or with specific parameters, for example, focusing on health impact assessments or climate change and health policy. While not currently a commonly observed practice, elective or selective courses could alternatively be removed and replaced with a thesis requirement, although thesis work, from what we saw, is typically set at the departmental level. So digging down to the more granular level, the toolkit additionally explores how to build a climate change and health course. The core competencies outlined by GCCHE can serve as a good framework for building such a course due to the commonalities with CEEF MPH competencies identified in the crosswalk as discussed earlier in this presentation. The table partially captured here from the toolkit is set up to list the GCCHE competencies along with associated learning objectives that can be used to build out a course. Faculty can take a range of approaches in creating coursework that operationalizes the learning objectives and assures that students can demonstrate the desired knowledge and skills. The toolkit does provide an example syllabus of how these learning objectives could be linked together into a course, which covers 12 key topics, listed here, along with associated suggested readings, learning activities, and assessments for evaluating student learning. But as stated before, faculty can certainly choose other ways to incorporate the core competency elements and respective learning objectives into a semester-long course. In the appendix, a more robust curated list is presented, offering links to publicly available readings, lectures, and courses, when applicable, that relate to each GCCHE competency. These materials can be utilized for any of the 3 components of the toolkit, whether looking to weave in content to meet required CEEF competencies, to design a single course, or to build out an entire concentration. Now, given the global audience on this call, I think it is important to acknowledge that this toolkit was developed primarily with US audiences in mind. For example, the focus on CEEF competencies and the basis of designing the 2-year concentration schedule off existing US-based programs. So I want to wrap up by taking a step back and talking about its application from a global perspective, because there are a number of aspects that truly do translate, and I believe make this a useful case study and tool for faculty around the world. For example, there are commonly required courses for the graduate level of public health education, such as epidemiology, biostats, environmental health sciences, health policy and management, and social and behavioral sciences. Programs worldwide often require some form of program culmination, such as an integrated learning experience, applied practice experience, a thesis, or a capstone that translates content into applied practice or synthesizes a student's cumulative learning. There are foundational competencies recognized across regions as being critical, many of which overlap with the required courses already mentioned, but also competencies around effective communication, advocacy, global health, ethics, and equity. This points to the shared experience of looking to integrate climate change and health into courses and student experiences noted in the toolkit, and the need for exploring how competencies in climate and health relate to the foundational public health competencies. In addition, frameworks, such as those put out by accrediting agencies like CEF and AFIA, or by organizations like the WHO, among others, are being utilized around the globe for curricular design and development, and offer an opportunity for aligning and coordinating widely recognized curricular approaches in public health with content on climate change. And, of course, there are critical themes emerging as globally recognized public health issues that fundamentally overlap with climate and health. There's climate change itself, of course, but also emergency preparedness and health security, issues in ethics and equity, and the need for transdisciplinary and interprofessional collaboration, all of which can be leveraged as a means to address the complexity and global reach of this topic. Before I close, I wanted to call your attention to the WHO Global Competency and Outcomes Framework, which is part of a broader collection, the National Workforce Capacity for Essential Public Health Functions collection, more commonly referred to as the WHO Workforce Roadmap. This roadmap centers around capturing the essential public health functions, EPHFs, their subfunctions, their delivery, and the competencies required to perform them. The Competency and Outcomes Framework provides an evidence-based, globally aligned reference set of competencies and educational outcomes. It can be used by schools and programs in designing curricula, or by governments and health agencies for workforce development, and seeks to move the public health field towards a more standardized approach to global training with national benchmarking of workforce preparedness. The framework presents 20 broad competencies in 6 domains and is highly non-prescriptive. They are meant to be adapted and applied within the regional and professional context. As such, there is, for example, no specific reference to climate change, but the competencies are designed with enough flexibility to take on climate and health applications that support the delivery of the EPHFs. This framework is just one example of a globally relevant tool that provides opportunity to infuse climate and health knowledge and skills into how we teach and train public health professionals. It could, for instance, be used in coordination with the WHO's Operational Framework for Climate Resilient Health Systems. Or, as we've done here, you could look to how GCCAG's competencies might align to prepare a workforce that is effective in addressing climate change and its impacts on the public's health. And with that, I believe I want to say thank you all for your attention and, of course, for your commitment to climate and health education. And I welcome any questions from the audience.
Thanks very much, Rebecca. Very thorough presentation of the actions in the US, and thanks also for referencing the WHO competencies and outcomes framework. There was one specific question for you. I don't know if you can answer it, but I'll drop it on you right at this moment because it is a very specific. Do you know how many CEF accredited programs in the US offer classes and/or concentrations in climate?
I do not, but that is information that I think was best captured by the GCCAG survey. Danielle, I know you said 44 out of 90. Was that US-based CEF accredited?
This was another survey.
Yes, that was.
I can have the right name and I can share with the participants regarding to US specifically. And the survey was voluntary, so only people who want to participate respond to the survey. So we don't have results of all the schools of public health in the US, but the ones who responded, I can share the amount of who are providing climate and health education.
That would be great. And it is something that we've been working on at ASPPH to do our own kind of environmental scan of what is taking place as we kind of enter this next phase in our climate change and health work. So if we get those numbers together, we will be happy to share that as forward.
The other survey that I show you, that I also present, among 90 schools of public health in the US, 44 was offering climate and health education. So it's about 50%, I believe, but I can check in our survey if we have a different number.
Yeah, but it is something we've been exploring to see because, of course, there are those different levels. Are they offering anything at all? Is it integrated within another department? Is it a concentration? And of course, a lot of you will understand now that some of that language is pivoting, which is fantastic in terms of carrying the work forward effectively when there is a lot of pressure around the terminology of climate change. But it also makes it a little bit harder to kind of weed out what's being taught and is it covering what we're discussing here today. So we are working on that, and thank you for that question.
Okay, I think the other questions probably relate to overall when we get to the Q&A. So I'm going to go directly now to Laurent. Over to you. Let's have your case study of European schools. Thank you.
Thank you very much, John, and I'm very happy to be with you. And it's really amazing to have more than 1,600 people in the other side of the screen. So let me share my screen. Is it okay? Do you see me? Do you see the PowerPoint?
Yes.
Yes.
I can see you.
Okay, perfect. So, I just will present this case study. Eric is not with me today, but he helped me to prepare this PowerPoint. And during this PowerPoint, I will try to just present how HASFAIR tries to develop awareness and capacity building in the field of climate change and health. And for that, we will go through, I hope that it, sorry, doesn't have a problem with this, with the PowerPoint. So sorry for that. We'll try to see, to do it in another way. Once again. Okay. Okay, is it better like this? It's okay, John?
Yep.
Okay.
Yes.
Okay. So we will go through three main activities. The first one, of course, is training. But I would like just to present that as School of Public Health or as faculties, we have, of course, to look at training, but also to some other activities and mainly networking and advocacy. ASFAIR is not as such directly involved in research activities. But actually, many schools of public health in our network contribute to transdisciplinary or interdisciplinary researches in this field. And I think it's really important because research gives the roots for updated training. So let's go now to training activities. So perhaps just two things I want to share with you. Because we have performed two different courses until now. The first one was, and the two were with the Global Consortium on Climate Health Education. The first one was on climate and health capacity building. It was like a global course, and you have in the International Journal of Public Health an abstract of the result of this course. And the second one this year, at the beginning of this year, was on the European Climate Resilient Health Systems course. And so both of them were really a success with more than 1,000 people attending the different sessions. And I think it's really important for us to do that because it shows that we are able to have this large scale training. If I go further and just to show these threse figures that we have done also in relationship with the Global Consortium on Climate Health Education, I think these are really important because these results are pre and post test about community assistance, about their confidence in carbon footprint reduction activities, and also confidence on how they can explain and assess vulnerability of healthcare systems. And you see in blue, it's the pre-test, and in yellow, in orange, the post-test. And it's quite clear that the people who attended the course are more confident after the course than before. So it's what we try to do in training activities, but there it shows very clearly that there is a move from pre-test to post-test on their confidence. And I think I just want to highlight that because these results show clearly that with such courses, participants are more confident and better equipped to address the challenges of impact of climate change on health. And the second thing is that we see that teaching is a powerful tool. So it's really important for us, for faculties, to know that we don't do this for nothing. Here, I just want to share also something that we do in ASFER. The first one is that we are fully involved in revisiting the new competencies and new curriculum in public health. So it's a broad activity that because public health is changing everywhere, we now have to face different challenges than some decades ago. So we have to regularly revisit the core curriculum, and it's what we have done last year. And with that, I just want to focus on climate change and health. And just to here, you see that we have a sub-specific area in public health on planetary environment and climate health. And I think also I want to just to focus on that because we are here in a webinar on climate change and health. But I think that we also have to clearly define the new concepts and the relationship that there are between the new concepts and between One Health, planetary health, and climate health. We know that there are some overlaps, but it's when teaching, I think it's important to make this as clear as possible. What are the relationship between planetary health, global health, One Health, environmental health, and climate change and health? In ASFER, we also work on developing a repository. That means that we would like to have a full understanding of what happens in the European region and WHO European region. And here we have developed this repository in close relationship with ECHO, with the European Climate and Health Observatory. And so that means that we will develop year after year this repository. And here you see that after a few months, we have nearly 30 training resources from more than 15 European institutions. It's free. It's accessible 24 hours a day and 7 days a week. We would like to do it in the different languages of Europe, and we split the training capacities in 5 categories from CPD to PhD, and also with vocational courses. So it's ongoing. It's what we do in ASFER now. There are 2 new activities that we want also to develop in the next months, and I hope in 26. The first one in relationship with the Global Consortium on Climate Health Education, but also with the European Climate Health Observatory, is a European course enlarged to not only public health professionals, but to health professionals. But Daniele has already spoken of that, and the Global Consortium is doing a lot on that. And we also have agreed with ECHO, with the European Commission and with the European Climate Health Observatory, to develop some guidelines for local policymakers and stakeholders, because it has been said during what you have presented before, but it's really important not only to do training, but also to support the local policymakers and the stakeholders, and it's what we intend to do at the European level with this project. About networking, so we are a network as ASFER, and the ASFER as such is 131 has 131 members, and we have tried to look to foresee how many School of Public Health as such, but it's different than the definition of a School of Public Health, for instance, in US, but how many other institutions are developing some training in public health. And we have seen that around 141 School of Public Health or organization developing training in public health, but are not members of School of Public Health, of ASFER, sorry. What is quite interesting is that you see the differences that the School of Public Health who belong to ASFER provide more climate and health education than the institutions that are not members of School of Public Health. So that means that being part of such a network perhaps is something that helps to develop content on climate change and health, even if we still have many schools of public health who are not providing climate and health education within our network. As I said before, we have a very strong partnership with the European Climate and Health Observatory, and it's what we intend to confirm during the next months and years, because we think that it's really important to have this close relationship with such an observatory. And also, we have many other cooperation at the European level, and we have just put some logos of some organization we are working with. Of course, we have also many relationship with the Global Consortium on Climate Health Education, or the Global Network on Public Health institutions. So it's where we are about networking, but I think it's really important, and even where you are, when you are a faculty, to have in mind that we cannot do the things alone. We have to develop such alliances and such partnerships. The last one is about advocacy, and I will just give two very short examples. The first one is about how to better equip health professionals to address legally climate change and health. And for that, and you see that we were not alone, we have supported a guide for public health professionals, and the title is From Analysis to Action, Climate Change Litigation. And it has been developed 2 years ago in 2023. And I think it's really important that to have in mind, and mainly when you are a faculty in public health involved in this area, that we have also to look at how we will be able to help things to change, and the legal aspects are really important. And that means also that we have to bridge between public health faculties and law faculties. And the second example is about how we will be able to develop something at broad level. And for that, we have decided in ASFAIR to develop a statement for the COP28, because COP28 was the first COP to have a day dedicated to health. So at that time, we have developed a specific statement, and we want to do the same for the COP30 in Belém in November, because COP30 will be a very important event, because it will be 10 years after Paris, and there will be also a day dedicated to health. Just to finish, and in conclusion, I just would like to emphasize that we really need to upscale our activities, but also to define a common corpus of knowledge and to exchange our experiences. And for that, such a webinar like today is really an important step. Thanks a lot.
Thank you, Laurent. Excellent work on a number of fronts there, from core curriculum to the law agenda, which is very important to us. Thank you very much for giving us that very inspiring presentation. We have 10 minutes, I think, for question and answer. And I've been looking through the questions as we've gone, and Maggie O'Donnell has been doing great work answering many of them on the spot on the moment. But it seems to me that there's a combination, really, three categories that I can pick out. There's the largely technical questions of the resources, how we enable you to use the materials that we've been talking about, that Danielle has been talking about, and how we connect you with websites and with the WhatsApp group. So a lot of those have been answered offline, off record. But there are also then questions about the hows of the teaching, and who can people look to as peers or examples of very good practice, those kind of questions. And then there are also questions around content and policy related issues, which I'm just going to call up where we are with the question and answer at the moment. Hello. And so, first of all, I'm just looking at the questions that have come up in Daniele's section. These are interesting ones, I think, for everybody on the call. If we develop a curriculum, will there be an opportunity to review and get recognition through GCCHE? And a related question about how do you join GCCHE? And also related, I think, in the reviews that have been done, were there any schools that we feel were providing top quality programs? I think they're all about peer review and peer support in a way, those questions. So, Daniele, have you got any instant thoughts, responses?
So you can use all the resources that GCC has available. It's open access, and you can use it. Please use it. And we made it to make your life easier. And because we know that it's a very heavy load of work, and we try to provide many resources as possible. And well, I think we can help. I don't know if we can help everybody in the world, but let's see. If we receive some curriculums, we can review and we can give some advices. But I think if you use our core concept, you will be very close to the necessary competencies that public health professionals needs to have. Regarding to membership, there are many different types of members. If your institution is providing climate and health education, you can become an institution member, and you need to provide a letter from your dean saying how many students are receiving climate and health education, and a commitment that you are providing climate and health education. You can also be an individual member, and you don't need to have that. And you receive all the initiatives that we have in our newsletter. And the last one was related to... Sorry.
Examples of good practice or best practice, if you like.
Oh, if we found a school like a champion school, we didn't do this analysis. We kind of were we want to have an overlook in the global perspective, what we need to do to help the schools and where the global schools were. So we don't have like, and also the schools who participate, they participate as anonymous. We know their name, but we can review their name. So we are not going to put like names and that are the top schools that are providing leadership and decision-making education. But the idea of this survey is to compose an adaptation indicator to the Lancet Countdown to understand how the regions and the countries are prepared to provide education to the future health professionals. So make sure that they are going to be adapt in the future. And that's it. We were not, and GCCHE also wants to identify where are the regions that we need to have to put up a major efforts and to work more closely. So if you receive this survey, we will have the survey on nursing school this year, and the next year we will have again the schools of public health. If you receive this invitation, please respond to us, because this is very important for us to build our initiatives and also to report where people are.
Thank you, Daniele, and I think you're quite right on the issue of not the champions at this point. We're trying to bring everybody up to a standard, and I think Laurent's slide of how people can feel much more confident about their teaching through these kind of initiatives that we have is a very important example. At the moment, it's an area of demand for knowledge and teaching, and so the more people that we can bring on board, I think, would be the most important aspect of what we do. I've got some questions that came up in Rebecca's during Rebecca's presentation. Not necessarily for her, but the questions about tailoring the model to early learners. How does public health? I've got several on urban planning, which you might have to refer people to later sessions here. Question, is it easy to get admission to study MPH in the US, which offers robust public health education, including climate change? Funding remains a major constraint for prospective students. How can this be filled for low and middle income nations? Might be a particularly difficult question to answer at this point, Rebecca, but is there anything you can say on that at the moment?
Yeah, that was a number of different areas there, but I think the early adopters, young learners, that's a great opportunity, and it's something that we are discussing in terms of the ASPPH K through 12 plan. I think there are ways to engage students. It would obviously look very differently, but kids are really curious. So especially now in terms of changing things from the perspective that we've had before into something more palatable across audiences, across regions, getting kids involved in what their local community is experiencing, so the lived experience, their family's experience, and trying to use that as an inroad, I think, is a really creative way to get them learning about what's going on in terms of extreme weather and risk and vector-borne disease. You wouldn't use that term, but why are things going that way in their community is a good starting point. The MPH programs, I don't think it would be right for me to say, are they difficult or not difficult to get into? I think the bigger question is about funding. And that is a problem in the US in terms of the cost of higher education. But there are numbers of awards programs and support for that. If you apply to it, we can share some of that information at a later date, some links to getting financial support for students. I don't know if that was an international question, but yes, there are a number of fantastic programs. I mean, I went to Emory, but many of our schools do touch on climate change and health education throughout their core courses, through electives. So we can share some of those resources moving forward.
Thank you. And I mean, I recall a paper by Heather Glasner and colleagues around the growing demand for climate change education in schools, and also the demand from employers for climate change knowledge. I don't know if that's changed in the last 6 months in the US, but certainly I think the principle of employers wanting and needing those kind of skills is probably a much more general global requirement. There was also a question, Laurent, that came up around in terms of the initiative in Europe. Have there been engagements done with African governments? If yes, to what extent? I could the only answer I could give to that is that the African schools have had the same process of the webinar series, similar to the two that have run in Europeans, ASFA and GCCHE. There is clearly a hunger for more work in African schools, and we'll be working with our colleague President Kaseya from the African Association of Schools of Public Health. So I think this there is a real hunger for this kind of work. There's a number of questions. I think we should still take away and try and perhaps summarize answers for you all. The issues of access, Maggie has posted the how to become a member of the global consortium in the chat, as she also posted the access to the materials, which is a page which is a work in progress, which as more sessions take place, more of the presentations for the next 10 weeks will be included in that link. And there were also comments about the the Columbia Plus site being under maintenance at the moment, which again seem to be have been answered offline. So the it seems to me it is time now for us to conclude the session, and I would just like to say that the enthusiasm which the 1,600 people have put into being here for an hour and a half today, I think it's absolutely brilliant, and it does demonstrate the desire and hunger for work on climate change and health education. I think over the next 10 sessions after this one, you will see some high quality presentations of content which will answer some of those questions about urban planning and also relating to non-communicable disease. There was a question as well. So I think the way this course will unfold will equip you all to be able to be confident as the people in Laurent's study in delivering programs of education about climate change and health. And ultimately, of course, to enable us all to promote, protect, and improve the health of the people we serve. So we live in difficult and dangerous times. There are many forces ranged against us in terms of politics and economics, and who don't want to promote an agenda of public protection and efforts to address climate change. I take it that by being here, you are not amongst that number. And I urge you all to both equip yourselves with knowledge, equip yourself with confidence to address the problems, and to advocate both with your students and with the public that we serve. So thank you all for being on this call, and do join us again next week. Thank you very much. Bye.